Starting. So welcome everybody. We are now at our fourth and final session of the Children's Behavioral Health Policy Academy, Family and Youth Voice Matters. And it's great to have everybody back today. And I'm going to spend a few minutes just trying to recap some of what we have been learning and then sort of pull the agenda today forward. You know, and part of the outcome of this training is to get us ready to keep a statewide family youth advisory board up and going. I did get a little feedback that the coalition name may be confusing because we have a few other coalitions that we're partnering across the state. So based on that feedback, I think we're going to stick with advisory board right now, which was the true intent of this group. So even though we've been calling it Statewide Family and Youth Coalition, I think we're moving more towards Children's Behavioral Health Statewide Family and Youth Advisory Board. So important as we get going, we have to remember again, part of what we're looking at is really gaining family leadership. And when I use the word family, I'm saying that in the broadest sense, parents, grandparents, other family members. We're talking about the children themselves, youth, young adults, and everybody either impacted or experiencing behavioral health challenges. And we want to build and make that voice strong by really becoming leaders and gaining the knowledge and skills that we need to meet the need and to be able to build positive partnership with professionals, other families, community, and state partners. And I think throughout this academy, we have been actually beginning to gain those knowledge and skills, and definitely have been, it's been awesome to see some of our state partners in leadership and other provider agencies starting to come together with us to build this community. But again, I think part of our role as an advisory board is going to be to help shape, and I'll talk a little more about that today. Also, as a family leader, where, you know, whether we're working as a peer professional or as an organization, we want to empower our families, providers, and policymakers to meet the service and support needs. And we've learned and even heard through our different sessions how powerful providing peer support, whether that's family parent peer support or direct lived experience peer support, and in the importance of educating and or advocating for the populations that we represent. So it's also important as family leaders that we're able to think about how we can transform service delivery systems, whether that's at a community level, a local level, state, and even national level of government. And we talked about those three branches of government, of how to really work and think about working with the executive branch, which would be our governor's office and state department agencies. It could also be our judicial branch, working with our courts and judges and such. And it's also our legislative branch and working with all our policy makers. So, and those key legislators are so important to get to know. So when we think about defining transformation, you know, transformation is a powerful word, and it has both implications for both policy, funding, and practice. And when we looked at those three branches of government, we started to see how we had to think at those three different levels. And just as important, it's around attitudes and beliefs, right? So sometimes we have to be finding the right individuals that we have to help them think about how they want to make decisions and partner, and hopefully even persuade some in the ability to have influence, because they might not already agree with us. We may have to do some work around that. Transforming represents a bold vision to change. So we have to be open to being change agents. The very form and function of children's behavioral health service delivery systems in Rhode Island to better meet the needs of children, youth, and young adults and their families. It is designed to serve and support, right? So we need to be able to really think and map out what does our service delivery system for children's mental health. And I think we've been doing a good job throughout this academy, starting to raise awareness around those issues and where we see some of the strengths and needs within that. And also, as a large scale organization system change, transformation can be complex. It's a complex process. It's nonlinear. Sometimes it feels like a few steps forward and then another step back, especially when you have changes in leadership. And it does require collaboration, innovation, and a long sustained commitment and willingness to even learn from our mistakes and shape it. So a good example is we could develop this great system of care and it could feel really good to us, but it never got legitimized in writing. It never got formalized. It never got written into legislation. And now the leadership that helped us develop it changes over. And we find that the new leader comes in and wants to do it all different. And that all changes because we never got it promulgated. We never got it in writing. We never got it to a policy level. There's been a lot of that in Rhode Island. And even when we've had a few times where there have been good policy, it's even harder once you establish a policy to keep it regulated, growing, and developing. So that is an area that we will definitely continue to look at. So again, we're gonna, the whole outcome of this academy and part of why we're recording and we'll have the academy available up on the website is because we want to build a statewide advisory board led by families, youth, and young adults to organize and promote systemic care leadership and transformation for our children, youth, and young adults with behavioral health needs. So that means, again, this is an advisory board that gets us strong in working in partnership with everyone. It is not for us to be the only board or sound, but help us to go join other boards that are taking place around the state and to have influence and to organize within ourselves. So again, system change transformation focuses on the policy level, which can relate to both financing, regulation, rate setting. We talked about last week about how some of the rates aren't strong enough we need better rates for getting good treatment providers, especially we talked about that at the residential group level. At a management level, that is, how are we looking at the data, quality improvement, our own human resource development, how we're organizing the system. If you could please mute. At a frontline level, okay. We're looking at, at that frontline practice level, how are we looking at like strength-based assessment, care planning, care management, like the wraparound process we were talking about, and that we have access to a broad array of services and supports and they're being provided and accessible to everybody. At a community level, how does the partnership with families, youth, natural helpers getting community buy-in? So that means if we're doing true transformation and we're really building family and young adult leadership and youth in this process, how is our voice really traveling across these levels? I know we've had to do a lot of development within our own organization at Parent Support Network to have staff working both within our own agency at all these levels, and then starting to see what does that look like out in across our system of care. So at a policy level, do we see family members sitting at the policy level helping to make those decisions? At a management level, are we starting to hire family leaders into key management positions as we operate the system of care? Frontline practice level, that would be like our whole family and peer support service provision and having family, youth, and young adults part of that peer network and really helping to deliver the services. And at a community level, how am I even getting what I need for my own child and family, to really getting all my natural helpers, whether they're friends, family, faith, and our churches, and everybody really getting involved at that community level. And we want to think about how we're from a system and service mapping, and we've started to talk about some of this in our different areas at that legislative process, like we talked of, both at a budget and or policy laws. How are we getting state agencies involved and shared leadership? You know, with Susan from DCYF has been wonderful as a children's behavioral health policy leader, but we know this is way bigger than DCYF. And how are we getting that shared leadership right up to our governor's office and all the state agencies? Regional or community authority and delegation, we see different initiatives come forward, and they delegate different roles and responsibilities down to a community or regional level. We're not a huge state like other states. You could go visit a county within that state, and that county might be bigger than the state of Rhode Island. So we're not really county based, but we're more regional or community based. Programs that our local, state, and federal agencies are responsible for. So another great mapping project is to be able to even take each of the different state agencies and what are the programs that they're operating and implementing that have an impact on children's behavioral health, and how much funding sources are attached to those programs, and which populations are they serving, and who's eligible, and can they access, or is it, you know, more of a pilot project that only a few people in a certain area are getting, or that it's accessible to everybody? And are we building true service delivery networks within the local communities? One of the big things we hear is how important local community work is, and that if I'm trying to access services and supports, I don't want to go from one end of the state to the other. I want to be able to stay in my local community. So as much as possible, even though Rhode Island is a small state, our families will tell us that they definitely want to be connected at their local community, and that we know how to navigate and access these services from a local, state, and federal level. So outcomes that we're trying to achieve and shape, and it definitely came up through the other sessions. We want to support our parents and strengthen families. The more our families are feeling strong, the better they can support their own development within their own parenting and implementing and supporting the life skills of our children and youth. We want to see access to a broad array of services and supports. We want to improve school attendance and performance. We want to ensure that our children, youth, and families are receiving culturally, linguistically competent services. We want to reduce psychiatric hospitalizations. We want to reduce out-of-home placements and the length of stay for children and youth as they seek residential or group care for their behavioral health. We want to reduce juvenile justice involvement and recidivism. We know that we still have many youth who find themselves involved with the justice system and are struggling with behavioral health needs. Increase parent and community involvement at all levels within the system of care, and ensure that our children, youth, and families, again, I guess I had that one twice, are receiving culturally, linguistically competent services. And again, improve preparation for transitional aged youth for self-sufficiency and transition to adulthood. So those outcomes are incredibly important. And how are we starting to look at the data or collecting the information and looking at studies that shows that the work that is happening is starting to make change in those areas? And how we operate as a statewide advocacy is to be able to do collective advocacy. And this is where we as a group of people who are facing a common problem have similar experiences to get together, work on these issues, have our voices heard, and that we may develop a campaign on the issues that affects everyone. So this will be a big piece of what we're going to talk about today as we develop our priority areas. And part of how we implement that is we got to find the facts. We want to draw attention of the behavioral health challenges that face us We want to share compelling stories, as we'll hear in just a few minutes. We got to collect those local statistics and data. Everyone involved is necessary. Everybody needs to feel meaningfully involved to have a voice to improve the well-being. So we need to find and collect that, that collective voice as many individuals. And this academy is a jump off to that, but I can say there is still many families and young people's voices we need to get involved in the process. We also have to recognize who are our allies. Who are those people that are going to help give us credibility, help us influence others? We have to think why we need this person. How do we find them? Who are those individuals that care about the same things as us? And who should we contact first? So when we talk about priority actions and strategies, I want you to think today about who are the people you know that could be our allies or champions that can help us move this movement forward. And we want to meet with different key opinion leaders at the community and state level so that we can get the information and the knowledge that we need and to influence, prepare for meetings, establish relationships, and analyze and document how we find. So we really need to be using all these different approaches as we're thinking about moving forward in our actions and strategies. And again, that just brings us to, again, trying to develop this action plan or campaign. What are going to be our action areas? What are the goals we're trying to achieve? Our objectives? What resources do we have to work with? Who are our allies, but who may oppose or push back on what we're trying to change? And how are we measuring and evaluating the outcomes? So that's a lot of, how we're working today to get to building and implementing a state action plan. So we'll have an exercise around that today. But what I'd like to do is stop here because we talked about how we want to ground ourselves in always sharing a personal story that connects us back to behavioral health. And we have Mike Macedo. Am I saying that right, Mike? I know you're on mute. If you could unmute. If you could unmute, Mike.
Oh, can you hear me?
I can hear you.
Oh yeah, Macedo. So you're close.
Thank you, Mike. Well, we are great to have you. I'm gonna take this down so we can see you. And I am so glad that Naomi connected to you and that you're willing to share your story with us today. For some reason I just lost you, so I'm trying to get you back up on the screen so we can see you, which I will keep doing. Hopefully as you start to talk, you will come back. So I'll keep working on that, but I am gonna stop and turn it over to you, Mike, to share a little bit of your journey with us.
Well, my name is Mike Macedo. I currently work as a clinical licensed clinical social worker and psychotherapist here in Rhode Island. I work for a company called CCAP, and I have a independent private practice, fee for service. So basically, what I'm here to sort of talk about is just a little bit about just kind of how, my journey to, through education and adulthood, how, kind of what worked for me, sort of what didn't. So I have Asperger's syndrome, along with obsessive compulsive disorder and generalized anxiety disorder. I also have a trauma history as well. And the reason I brought up my employment is because I, over the years, have found a way to use sort of what, my diagnoses, for lack of a better word, to help empathize with and treat the folks that I work with, many of whom are adolescents on the autism spectrum. And as I, go further with my career, my goal is to someday have that be the, the bulk of my, client base, working with the autism community, especially the high functioning and in young adults who are high functioning, because I feel that that's a demographic that is very ignored really in our society. So basically, I was diagnosed when I was 8 or 9 years old at Bradley Hospital in the late 1990s. I think it was 1998 or 97. And at that time, people didn't really know much about Asperger's at all, just because it, wasn't in the DSM-4 TR that long. So, I mean, my parents had no idea what it was. My teachers had no idea. But leading to that, I was exhibiting very, really just rigid and defined behavior. I just really couldn't get a grasp on a lot of my emotions. So there was a little emotional deregulation, and I just really sort of struggled fitting in. So after I was diagnosed, I was put in a sort of a support group, like a social skills group for other kids who were diagnosed with autism spectrum disorders. And I found that really helped me. But what really even more so helped me was my school, the school who didn't really know anything about Asperger's, really. They accommodated me right away. They allowed me to take a separate math class. I had a one-on-one support. I also, like my teacher would just do little things like, let me walk, let me walk the hallway with her, just to cool off if I was really just, anxious or anything like that. So little things like that. And I feel like that really helped going forward. I was also, I'll only talk briefly about this, but when I was like in 5th grade, I developed juvenile pilocytic astrocytoma. Basically, I had a brain tumor that caused hydrocephalus, and it wasn't cancerous, but I basically just had to sort of like put my whole life on pause for about really a year and a half, more than a year and a half, through the surgeries. I was in the hospital for 2 weeks, and surgeries, chemotherapy. During this time, I transitioned to 6th grade, middle school, and really it seemed like a lot of my existing accommodations to really work with my ASD diagnosis really were not really replaced with, but almost overshadowed by some of the accommodations that I now had to have as someone who was, leaving school early every Wednesday for chemo treatments, and, giving me extended time to do assignments because I'd usually be sick the next day. Sometimes I'd make it to school, but sometimes I wouldn't. And so in a way, a lot of my accommodations sort of were on the back burner a bit. So by the time I got healthy, this was in 8th grade, like I was like, okay, picking up where I last left off. It was 7th grade. I was sort of picking up where I last left off in 5th grade, socially, and even, really kind of emotionally as well. And, I still didn't really know how to like make friends, really. I had all this free time. Some of the things I used to love to do, I had to quit doing, like playing bands, I for medical reasons and everything. So I really had a hard time sort of just figuring out who I was. And academically, I was not a strong student. I'd try hard. I thought I felt like I was a smart enough guy, but like I just never got very good grades, mostly C's. So, this sort of translated into kind of just an angry, bitter kid, basically. I had a younger brother who was like excelling in, sports and school and stuff like that. And here I didn't really have, much going on. So I started to develop I sort of started to shut down a little bit more. And, I developed certain maladaptive behaviors, self-injurious behaviors. And what really kind of saved me was completely by accident, kind of signing up for high school sports. I did high school cross country and indoor and outdoor track. I signed up blindly in 8th grade. I didn't know what it was. I just knew it was a sport, and I was tired of being, bullied, and I, was tired of getting in fights. So I just signed up and, started running in skateboard shoes. I didn't know anything about it. And that, for me, that translated, that was a perfect segue into high school. And basically high school, my accommodations kind of stayed the same, which were extended time on tests and certain assignments. I was in a math class that was not, at the same level, I guess, as some of my other classes. So that was sort of another intervention. I had a word processor that I could use, an Alpha Smart word processor, because I write very slow. But what happened was I started off very slow with running, but then I started to get better all of a sudden sophomore year. And so I was like the second number 2 guy on the team. I, was a pretty good runner, regionally, locally, I guess. I went to Pontiac high school, by the way, graduated in 07. And really, so what happened was I don't know, sometimes my teachers would really or some of my even resource teachers really just knew me more as like, the runner, the kid who likes to, the kid who's pretty good at that. But like, I was still getting B's and C's, and it felt like, I don't know, it felt like I didn't really know what to do to get better grades. And that was still important to me because, I'm a competitive guy. If someone I know is getting better grades than me, even my brother or whatever, then I got to get them too. And I was college bound. I mean, I knew I was going to be college bound. I'm a first generation college student, or I was at the time. So I knew that my parents, they've been telling me since I was a kid, you're going to college. So I knew that was going to have to happen. So around this time, I started to educate myself about having Asperger's. I worked with a speech pathologist who really kind of helped me more with social skills. And that's probably sophomore year, junior year. That's what really got me into really kind of learning more about myself, what makes, what makes me tick, I guess. And that sort of helps motivate my interest in mental health. So, getting good grades was important. And I just didn't really, I also had this elective that I took where I could basically just catch up on work. But, sometimes you need more than that. And I graduated high school. I didn't care by the time I was a senior. I was just like done with that place. But I made it. And when I got to college, you do have to care. And so I found that out right away. And, my accommodations were similar. And for lack of time, I won't talk too much more, but basically my accommodations were extended time on exam, separate location, and that worked for me. So I graduated from Rhode Island College with a BA in psychology in 2012, and I graduated from Rick also in 2016 with a master's in clinical social work. Oh, do I have a question? Oh, sorry, there was a hand there.
I was clapping.
Oh, thanks. Anyways, so when I was in grad school, I sort of made the mistake of not really connecting with disability services, what they're called, on the Rick campus, because I figured, all right, I don't take exams in my master's program. It's all papers. So I just didn't really think I could do that. But I had a field placement where I had a supervisor who didn't really she said right away in the in the interview for it that I'm not really sure I'll be able to accommodate you, because it's a fast-paced environment. And she wasn't kidding. It was, basically I just had to hit the ground running. I was an intern at a middle school, and what happened was there was no learning curve, and I didn't have that time to just sort of pause and have things explained to me in ways I could sort of understand, because I don't always process things well, verbal instructions well, especially stacked instructions like, okay, I want you to do this, and then after you do that, go to, I don't know, so and so and get this form. I didn't always have time to just write that stuff down just so I can remember it. So it set me up to fail. And what happened was my professor for that internship, basically, I guess they decided they were going to let me go one day. I think it was in November, and that's what happened. And basically, I found out from there, that I was kicked out of the master's program. So I had to take a semester off, and I had to appeal to the Board of Educators. It was, embarrassing, humiliating, but I knew I still had a second chance. And this time I connected with Disability Services, and they rewired my accommodations to include me when I'm in the field placements. So not just with assignments, but when I'm in my internship. And my second internship was great. It was at the school, it was at Rick. And my clinical internship was at Roger Williams Hospital. And my professor, who I had with the failed internship, didn't think I could manage in a hospital because it'd be too fast paced, but that ended up being my favorite internship. And I did really well there, and I loved it. So sometimes finding just the right accommodation can really just make a huge difference. I probably should have mentioned my parents' involvement in my path. So, like I mentioned, my parents, I don't really come from a family that's really well versed in mental health or anything like that. I'm really the first in my family to choose a path even remotely like this. But from day one, they read books about Asperger's. I think my dad's favorite book is Running with Scissors, probably, or I forget some of the other ones, but yeah, they educated themselves. They looking back, I realized that they would, explain, they'd give me certain accommodations. Like, I used to get freaked out if we'd make like plans as a family to, like, I don't know, drive up to New Hampshire or something like that, just randomly, back when gas was cheaper. And that would freak me out. It'd be like, whoa, I was thinking, I don't know, like I felt comfortable just being where I was. So if they learned that if they're ever to do that, they'd have to give me a few days notice. Just little things like that. But they always, encouraged me to just sort of, do everything that everyone else does. But once I sort of came of age, and they sort of explained, I have 2 minutes left. They sort of explained everything, kind of about Asperger's, and really, just explaining and really wanting to learn from me. So I would say that I've had some good help with my parents. So I have a couple minutes to wrap up. But what I usually like, so I've been doing a lot of speaking engagements lately, and I just finished. I just wrote an article on the Son the Mighty. It's about accommodations in the workplace, and I know I don't have time for that right now, but I feel like in a lot of ways, the accommodations you have when you're in school, high school and college, they still sort of carries over when you're in the adult world. It's up to you now to sort of self-advocate for yourself, disclose, finding the right time to disclose, and really working something out with your employer. And sometimes it's, sometimes office culture plays a big part in it. There are some places that are willing to do that, some places that aren't fortunately where I am. There's a really kind of an eclectic process. Like I feel like they're willing to learn, they want to learn from me instead of just having to deal with me. And I mean that makes a huge difference with me, and I think it makes a difference with every adult, like young adult like me that, you know, is on the spectrum and is, you know, in the working world, no matter what the profession. So that's sort of some of the accommodations that I received, and I'm still, it's still ongoing. It's still a live thing. Like I'm sure down the road I'll need certain other accommodations, if you want to call it that, you know, things to sort of help me process things differently. So I have certain issues, you know, things I have trouble with now as an adult that I didn't as a teenager, just because there's different things being thrown at me. So I think that no matter what your life accommodations are, you know, it's a live thing. It will always sort of, you know, upgrade. So can everybody hear me? Left? Am I out of time?
Yeah.
Yeah. Yeah.
Okay.
Awesome job, Mike. Thank you so much.
Thanks. Oh, my pleasure.
Yeah, just to hear your journey and where you are now, it's so hopeful, and definitely I'm guessing people inspired you along the way, and
Definitely.
and it definitely sounded like a few people threw some really big challenges at you too, and so glad you didn't give up. So glad that you went back and became the advocate, just your perseverance in itself to now be helping others. And I think that you're special, you know, that you're even taking it to a specialty level is really cool. So
I'm hoping to build, you know, I'm building a website. I'm trying to get more, you know, engagements like this. I've been doing this for about 3 to 4 years right now. And now that you know, I'm doing some writing too. I'm hoping, you know, just to kind of build from this, because I like doing this more than anything. So
yeah.
you know,
Awesome. You know, I always say we take some of our challenges and we make them our strength, and you're definitely a testimony to that. And
thank you.
it so fits with our peer world. But I think what's really awesome about this, we are always doing this work peer to peer, and you've been able to bring that right up to a clinical practice level. That's groundbreaking. That's like
Thanks.
thinking outside the box. And I love it. It just shows if we put our mind to it, we can achieve a lot.
I mean, you know, I think this is not exactly a novel concept, really. I mean, like you know, if you're someone on the spectrum and you need individual counseling, then I mean, who better will sort of understand you at a certain level than someone who experiences that themselves? You just, you know, I don't know. I think some of my clients might know, some of them don't. I just, you know, if they know, they know. If they don't, they don't. But
Yeah, but it sounds like there's a real one part, I think Esther put it in the chat too, that encourage young people to reach out to the disability centers to get those accommodations. And then
definitely.
and then not only did you take it from the, you know, that higher education support level, but it sounds like you're bringing it right into the work world now too.
Yeah, and that just kind of got thrust upon me. I sort of had like no choice to do that, and you know, I'm glad, because you know you need to. I mean, I'm about 4 years into working full time, because I felt like I was in grad school forever. I'm 31 right now, but it's like nothing I've ever experienced before. But it's the kind of thing that like I'm starting to get really used to it, and I think that being able to advocate for myself is big, and I'm still able to do that even, you know, where I work, where I've been now for about 2 years. So you know, it's definitely important to do that.
Excellent. Thank you so much, Mike, and you're welcome to keep joining us. And we understand if you have to get back to your work too, but thank you so much. And I think you've inspired a lot of us. You've got some great chats and thank yous in there. So thank you again.
Thank you. Yeah, and if anyone wants to get in touch with me, my email address is mmmacedo532@gmail.com. And unfortunately, I got have to head back to work. Fridays are busy for me, but enjoy the rest of the academy, and I hope to connect with some of you folks on the road.
Definitely. Take care, Mike.
Take
Thank
care,
you.
Mike.
Yeah, you being asked if you could put your email in the chat so folks can.
Yeah, I'm doing that right now. Good call. I was just about to sign off.
Thank you.
No problem.
So how we're gonna transition, guys, is we have everybody received a worksheet, and in the
I know.
we have 6 different priority
That's it.
areas. So within that worksheet with the 6 different priority areas, we want to begin to focus on how we're going to grow. So one of the things that before we start to go into those breakouts, we haven't talked as much about you thought last week, and you have your notes, everybody. So if you weren't with us, you should have received copies of the notes this morning. And if you were with us, I ask you to refer back to those notes, because what we're going to do today is we're going to pick an action step within each of those areas. And we're going to look at things both from, again, how we looked at home, school, community base. And we also looked at residential and or group. And we also looked at acute care. One other way we can also look at things is from early childhood, which could be like birth to 8. I'm not as hooked on the numbers, just thinking about the age level, but early childhood to then school age, which I'm thinking is more like 8 or 9 up to about, 14, 15. And then we are looking at our youth in transition age young adults, which we're thinking about 16 up to about 26, I'm guessing, as we think of young adults making that transition.
Lisa,
Yes.
I just say that transition starts at age 14, like a lot of the services. So I don't know if you want to.
We can definitely go there. We can definitely think that.
I mean, I know there's a nice, but I think age 14 is what
we can definitely start there, because I know if we connect it back to even special education accommodations, there's
Right.
a lot of
the transition,
of transition. So we can definitely go there. And I think some of the challenge that we've even had is when you're thinking like at a youth connection level, right? Like a youth peer support level, maybe thinking like 13, 14 up to about 18. And then we have 18 to 26-year-olds getting together. So it's always hard to determine from a peer support connection level of that population in that way. But I would definitely agree with you, Deb, from a level of really needing and accessing services, it could be as early as 14. And usually I know my son actually had that within his IEP at age 14.
If I could just add, thank you. Hi, Deb. It's Joanne. Hi, nice to see you. I'm the East Bay Regional Transition Coordinator, and Naomi did send me this link to be able to join today. And, when you think about just transition and that journey of transition and how we look at it in the lens of the schools in transition, is we really start to be very purposeful and intentional in building in programs and purposefully teaching like self-determination, self-advocacy, and looking at building and how to build networks of support within your family, your community, your peer groups, to start then and then continue. But when you think about kids in school, the best thing that we can do is even from a young age, we look at self-directed IEPs. In elementary school, we have students that are introducing people at their IEP, right? That are talking about, people that are in their lives and that are important. And the more that we do what we do and are consistent, then it'll just become more a natural part of their journey of understanding themselves and how they want their life to be. And those conversations will unfold naturally.
Very nice, Joanne. And because I believe the younger we do empower our young people, the stronger they're gonna be and own that. And then we would hope by high school, they're really owning it, right? And they're driving it and
Yep.
leading.
Yeah.
So
And I think
so
oh,
important.
please, I'm sorry, Lisa. I
No,
just,
go ahead.
and it's important for us as adults too, because I think unless we really take a step back and look at them as, you know, thinking, breathing, you know, human beings too, you know, we want to like answer for them or, you know, kind of direct their journey as opposed to giving them choices on the way, right? And teach them decision making so we can really learn more about who they are, right? If we stop and take those moments to listen, right? And assist them on their journey and guide them to be and evolve to be who they are meant to be.
Very
So
nice.
thank you for the time. I know I
Oh,
just jumped on a little later and but so thank you.
Great to have you, and I love what you and Deb are sharing. And Melissa, could I put you on the spot because you know we're talking about this empowerment as early as we can around our young people, but I think from an early childhood level, we have to think about that in a different way too with our parents. Could I put you on the spot to think about it from the early child level?
Sure, it is definitely a different lens when we think about it from early childhood because we're really thinking about that birth to age 8. And when we think about children who are 2, they don't have the language yet. So it's hard to know if they're having difficulties expressing themselves. We maybe don't have experience with other children. We maybe only have had that baby. Our friends don't have babies. We don't know what to know or expect. And, you know, in Rhode Island, we're really fortunate. We have great early intervention programs. We have great home visiting programs that give families the knowledge they need to really know and understand their young children. And I think too, with our young children now being able to go off to universal preschool, we're seeing some of those signs and symptoms earlier because professionals are getting their eyes on them as well. So you're getting a relationship with a teacher who's used to working with 3-year-olds who can say, hey, have I noticed? Did you notice this too? What do you think? And helping families start the dialogue and showing families the path that they can take to get their children the services they need. Because when you go to the pediatrician, you get 15 minutes if you're lucky to talk to your pediatrician about what you're seeing in your child. So these support services that Rhode Island offer, even prenatally with our home visiting programs, are a real asset to all families, especially families who have children with special needs or other disabilities. So it's definitely a different lens for families when we're talking about early childhood.
Yeah, but I see that same common thread, Melissa, of the younger we're empowering and understanding that from that child's perspective, how they're seeing the world,
Yes,
them socially and emotionally, and I think it's great as we begin to look at this. So again, definitely as we go into these small groups, we want to think across the service array, but we also want to keep in the context of the needs of the children and during these different, and again, it's hard to put just like a pinpoint age, and I appreciate the input around that. But again, we know that there's this recognizing, as we go around child development and helping folks to thrive. So with that, we're going to break down into 3 groups, and we've had a little few changes in as far as breaking down into our breakout groups, as far as who's going to be our leaders. And again, we have broken them down. I think that we're going to have Danielle, Renee, and am I saying it right? No, is it Nwando? Am I saying that correctly?
Wando, silent N.
Silent, oh, Wanda.
Silent N, so Wando.
Wando, thank you. And so you guys are going to be our first group, and then Tara, Melissa, and Esther are going to be the next group. And I know Renee had to step out, but she'll probably rejoin. So anybody wants to jump in and help. And then we're going to have Kyle, Nadine, and Naomi, who may have to jump out, so anybody can help jump in too. And I am going to have you go into these groups. You're going to pull up your worksheet, and I want you to, you're going to have about 10 minutes or, about 10 minutes for, 5 to 10 minutes, because we're running a little late, around each of the areas, and just pick one action step that you can all agree on and try to get to one strategy around that area. And so you want to have sort of a fast-paced discussion, and so that we can at least get to some action steps and strategy that goes with that action step. So I am going to create the breakout room now. And with breaking that, making the room, let me see if I can make sure I get the time set up good and make sure I get my facilitators in the right rooms. That's what's going to take me the most here. Sorry about that. So we've got our first one. We've got Melissa. So we got Kyle. Just about there, guys. Sorry. One. Melissa, Town, Esther, and then I got Danielle. May. I think we're there. All right, I'm gonna open the rooms, and if I have anything wrong, I'm gonna move you around real quick, but I think I'm there.
We back.
It's me again.
Your voice sounds different today.
I'm not using my headphones.
Oh, that's right. Oh,
I'm using the computer audio for the first
that's
time.
it. That's it. It is the first time I think I'm hearing you through the actual computer.
That's funny, Kyle, because I was thinking the same thing, and I was like,
Like, who is this woman that looks like Melissa?
I hope it's not too annoying.
I used that technique on Wednesday. It worked great for doing the videos.
Oh, did it?
Yeah.
Oh, I'm so excited. With my children not being here, I don't have to keep the earphones in, so it's the first time that they've not been here.
Well, I had to hide all the razors, scissors.
Danielle, can I tell them what happened? We're in training together, and Danielle's doing an amazing job presenting, and her son cut his hair in the middle of her presentation.
Came like on Zoom and was like,
On
hey,
Zoom is like,
Mom.
look at my hair, and he was missing a whole bunch of hair.
Mind you, my older son did that like last week, and I hid the clippers. He just found plastic scissors and cut his hair with plastic scissors.
Are we just saying running with scissors?
Yes.
And Danielle was a trooper. She was like, she put it on mute. She said something to her son. She got back on and went right back into presenting like nothing happened. And at the end of the presentation, she was like, and by the way, my son cut his hair. Her 3-year-old.
That's our kids, right? So welcome back, everybody. Welcome back. I was visiting all the groups, and I heard some really awesome discussions and information. And if we could have each group report out, if you could sort of just summarize it. So I'll ask if I'll have Danielle go first. Danielle, can you summarize what your group came up with?
So for early childhood, we were focused on the establishing a continuum of care and linking all providers together to provide individualized services that would begin in the school and carry throughout. And that was not specific to youth who had 504 or IEP plans. This would be for every single child. For school-age children, it was essentially the same thing, creating a multidisciplinary team approach for every student, after-school programs, providing transportation, community centers. For home-based services, we were thinking about creating a peer tier system that was trauma-informed, that would include peer mentors that were volunteer-based. For acute care, we were talking about creating a statewide protocol response for a 24-hour in-person crisis intervention hotline that would be funded by volunteers and on-call staff within programs that are involved. For residential care, we wanted to increase the opportunities to gain credentials so that way the employees would have more education. We did talk about better benefits and funding. We really didn't get that far on action steps on how to create that money, but we did talk about creating a training certificate specific to residential staff that would be or include trauma-informed care and implementing life skills curriculum. And then for youth and young adults transitioning into adulthood, again, we talked about a life skills curriculum that would be partnered with a mentor who could keep that continuum of support through their transition. I can't hear anything you're saying. I don't know if that's me or.
No, that's me. Anybody have anything that they would like to add that was in the group with Danielle? And with quietness, we will go on to Melissa. How about your group?
Sure. Tara, can you just share your screen real quick so I can look at our notes? So when we were all discussing the different things, we decided that across the board, wraparound services was a high priority. And by wraparound services, we mean services and supports that are holistic and based on the individual strengths, needs, and goals, with specifics around belonging, mastery, independence, and generosity. And we felt that this wraparound was really important to have from our early childhood right down to our youth transitioning, and making sure that it was really child, youth driven, family driven. It wasn't services that providers decided families needed, but families decided families needed, and children decided that they needed. And in our perfect world, we talked about how even our youngest children, kindergarten, could say what their goals are at the beginning of the year, and did they meet those goals, and what are their goals for next year, and really making it a living, maturing document as a child grows, develops, and becomes a young adult, and focusing on letting their path be their path and letting it not be something somebody else determines for them. So, for example, if they're not college bound, that's fine. Let's find where they belong. Let's help them master and be independent in whatever skills that they choose. But we thought that wraparound services was really a thread that we could continue throughout the lifespan.
Excellent. And I'm sort of hearing agreement between two groups now, where Danielle's group called it an individual plan, but I hear you guys taking it a step further with the wraparound. And so it's, you guys just expounded on that even more and put a practice model to it.
Yes.
Anybody else from Melissa's group want to add? Excellent. Excellent job. And how about Kyle? How about report out from your group?
Is our screen up?
Yep.
Okay. So we really focused on, we got really deep into residential group care. A few people having some in-depth knowledge there. The main issues we saw were probably not in the exact order, but education, salary, and staff ratio, and staff total. The ratio of staff to the residents, and just a general staff ratio, because there was a talk of a lot of burnout, and then also having multiple levels of care that are needed. And so when we got into that, some of the things like having certificate programs for people to be able to work and take part there, who would be at a different pay level and different experience than maybe somebody with a degree, but certainly there is a need for people of varying levels and how they're going to interact. So one of the things we're thinking is no more than 3 residents to 1 staff. And in order to supplement those who may be in a position where a degree is necessary, have people like peers with life experience, volunteers, or student interns, or even, as I mentioned, the certificate programs, which would be available. And in order to have appropriate salaries, funding to create salaries that reflect the education level. Certain times there are people I mentioned who have these degrees and then they're being offered, $15, $13 an hour, and they have so much college debt and stuff. It's not worth it for them in any way. So it's hard to retain people for that level of position in these residential care. And another part that came up was, if these things were mandated, there's not a lot of oversight or enforcement for the mandates. And that's something that we felt needed to be addressed. And also the stigma that in these residential places, that they're like glorified babysitters, whereas this work is much more entailed, it's much more stressful and consuming. Then we also we got into a bit of home, school, community-based. So we had the lack of cultural relevance, inabilities to meet people where they are. Lots of times there's sort of band-aids put on rather than addressing the core issues of problems. And a lot of these decisions are made without involving the children themselves or their caretakers. So some of these strategies we were suggesting are trainings and implicit bias. That's a main one. Treating the issues, not symptoms, which involves digging a little deeper and not just putting band-aids on things, hoping they'll go away. And then meetings like a youth advisory board or community meetings that actually involve those who are directly infected, the students themselves or the children and their caretakers, to get their input and really use them as part of making these decisions that will ultimately affect them the most. So we went pretty deep into these areas rather than trying to cover all of the others. That was our strategy.
Nice, very nice, very nice. Anybody else want to add from Kyle's group? Great. So Kyle, can you take that down and send it to me? And thank you, Tara, for sending yours. And great if Danielle could also, you could send yours. And, you know, I think this, you know, we heard some common themes, we heard some different things, but if I was to try to help summarize some key areas, that definitely this individualized plan, and I think Deb brought this up in an earlier session, this individualized plan, and even better based on a wraparound model approach that follows the young person as early as possible, right through all their ages and stages and right through up to adulthood. What a world that would be, right? So I think that's a strong area, and I'm excited to share. We have been working with Michelle Stewart Copes, who's a wonderful facilitator, not only around cultural linguistic competence and her work in that area in health equity, but she is also a strong wraparound trainer. So Michelle has agreed to come and do a lot of wraparound training. So that's one area that we're going to be able to take some leadership as a family and youth voice to be able to start to offer wraparound training to our full behavioral health workforce. So it's exciting that you guys came up with that. I came up with working with Michelle and introducing that, but no idea that you guys were going to prioritize it in the work. That just is exciting. And the great thing I can say about wraparound is I've been involved with wraparound development. Wow, it just shows my age, since 1993. And I have been part of the development of that planning and process. So one thing I can say to you as a family member that's been involved, it is extremely family and youth driven. So there couldn't be a better practice model that instills what Kyle was saying and a few others were saying about family and youth driven in an approach model too. I think another big theme that cut across everybody was the residential workforce development. And I couldn't say there is so much agreement with what everybody here in the room in this group is saying that matches to what has been being discussed at the Coalition for Children and Families at their level of discussion around workforce development. And there actually is a policy document that they have developed that even highlights many of the same things that you were saying. So I think of right away when we bring our family and youth voice together, we could join together with the Coalition of Children and Families and begin to bring our perspectives together, and we can make sure everybody's getting that policy document that they have developed to see. Because again, I hear a lot of commonality there. I think another common theme that came up was this whole theme of peers and mentors that move along at a home and community, school-based, but I sort of heard it across right up to even crisis response. So that whole ability to make sure that we're building that, whether that's at a volunteer level the workforce level and or also beginning to think about it. What I liked that I heard was also utilizing providers in the roles that they are in too. Like we don't have to create new roles if we all are working together on that. But and then the 24-hour crisis response model seems to be a huge piece. And then to make all of this work, which I was excited, Kyle, your group found the validity of an advisory board like we have here, but there are numerous family and youth-led advisory boards across the state. So I think learning about who they all are, how we better communicate and coordinate and partner together to make sure things are becoming family and youth driven. And the other key area I heard that, and that was also the cultural sensitivity and responsiveness within that. So, those are, just 5 big topic areas right there, but they sort of build on the themes that we have been discussing throughout. Excited to see this. And, in just our last few minutes left, I'd ask people just, if they want to do just a shout out, one person at a time, how this experience has been for them. You will get a formal evaluation. And once you get that in an email, and once we get the evaluation back, then you will also get your final certificates. And if you participated in all the hours, it will count all the hours. If you just participated in a few sessions, whatever hours you put in, that will be on your certificate. And we will also share this recording. So at this time, I think everybody's done awesome. I hope you're going to continue to be involved as we get this family and youth advisory board up and going. And just like to see, in the chat how this experience is. And definitely, if you want to add, I thought I saw a hand. Was that a hand for happiness, or Kyle, you had a hand?
Yeah, something that came to mind, and it's really been common, is how lots of times it's not the people with the degrees, more the lived experience and peers who are having a big impact. And it just made me think of like the Good Samaritan law. I would always think of that in terms of like a medical situation, but not in terms of a mental health. And I don't know if it covers anything like that, but maybe some way of, like it's okay to talk with somebody even if you don't have a degree, or to step in and try to give that sort of support without having, being a psychiatrist or psychologist.
Excellent. I think you make great points, and that just shows the power if we're all working together, and we each bring different perspectives to the work. Definitely. Anybody else like to share? And definitely please feel free to put it in chat too.
I was just wondering about moving forward, if you could review what you said earlier about kind of the next step if we want to connect. And
definitely, Jessica. So it is our hope to, again, December will be a little bit hard because of the holidays and that, but starting in January, we will start to hold monthly meetings. And so we're going to take all the information gained and learned, and that was part of why we wanted to hear the voices and the priorities. This is not the final action plan, but I think we have some real good areas to sink ourselves into that this group has been able to come together with. So we will definitely be working to get a monthly advisory group up and going, definitely inclusive of families, youth, young adults, thinking about who we need to bring in. As we think about those allies or key people we need to influence, we may bring different speakers in, we may have some data presentations, anything that's going to help us get strong. And then also, if we're all sitting on different boards and starting to get involved those boards, what are we learning at those boards? How do we bring that information back together? How do we prep ourselves? A lot of times we go to those larger policy boards and we're there in body, but we're not quite sure what message to bring. So part of our advisory role will not be only to help bring our voice to those boards, but what are we learning together to bring back? And what are some key messages? So, you know, we're going to have some key action areas and ways that we can be strong going to partner at these different boards, but there'll be monthly meetings. Another question will be in the evaluation, or what are your best days or times? There's never a perfect time for all of us. I know that, but we'll definitely be looking at it to get as much participation. And I would love that we can record our meetings. So there's many families and youth who may not be able to attend. And that's why I wanted to record these sessions too. And I think this is the kind of information that will encourage other family, youth, young adult leaders to come forward and participate. And it will educate our partners if they just go on and listen to our meetings.
Lisa,
So-
when you said you were recording these, how is it going to be? Is this an opportunity for those who couldn't be on this to, like, how are you? Is it?
We're cleaning them up a little bit, Deb. You know, we're reviewing them, cleaning them up a little bit. And then we're going to put them all up on our website. So we're going to have a statewide Family and Youth Advisory Board webpage and all these. And then I hope going forward, all our meetings will also be virtual and they will be recorded and up there. And we'll also have our minutes or formal, like we've been doing through this process, to capture our work. But I could even see some great white papers coming out of this, great ways that we can inform, and we just want to keep the momentum. So,
Because I bet you there are people that would have loved to have been part of this, that, you know, it's just one of those things you just don't.
yeah, and it definitely wasn't a big time.
So,
Yeah, and
you know,
there
how do we let them know, you know, so.
So agree. So agree. And so I think the more that we can record it, people see the validity of it too. And then they're like, oh, they're doing some good stuff. I want to get involved in that. I hope it's going to get that momentum. And again, I just want to thank all our state and provider partners that joined on to this too, because sometimes it's lonely being the family and youth, young adult voice, and we need our champions and allies and to really carry that family youth driven approach. So I am excited by that. And I hope this is going to just help that to grow too. So any other final comments? I know we're going a few minutes over, so I want to be sensitive to the time with everybody. So there will be some evaluation question or two so that we can get down to our best time and offers. And just looking forward to this really being the beginning of something we have really needed for a while for children's behavioral health to get where it needs to be, because we have definitely had some challenges. So again, thank you, everybody. I really appreciate it. And you will be seeing the evaluations and certificates early next week. So thank you and have a wonderful holiday, everyone.
Thank you so much for everything.
Thank you. Take care.
Thank you.
Take care.
Thank you.
Thank y'all. Good to see y'all. Happy Turkey Day.
Take care.
Bye. Happy Thanksgiving.
Bye-bye.
Bye.